I'm with Dr. Brian Westerberg, head of the Division of Otolaryngology at St. Paul's Hospital. Dr. Westerberg, what drew you to the practice of medicine at the BC Rotary Hearing and Balance Center at St. Paul's?
So the center here at St. Paul's is probably the center that's most known for hearing and balance disorders in the province. It's a center that really caters to providing high quality care for the most complicated patients in British Columbia. So it's sort of the mecca, if you will, and the place everybody wants to work.
Tell me about the new name of the center and how it better reflects the care and scope of the center.
The center originally began with an emphasis on hearing with a cochlear implant when it was first introduced in Canada, actually in 1982. The first cochlear implant was put in at St. Paul's Hospital in 1982. That relationship began with the Rotary RHF Hearing Foundation at that time, and the Rotary Club of Vancouver has put a significant amount of money into the clinic, hence the name had been Rotary Hearing Clinic at St. Paul's Hospital, despite the fact that we did a significant amount of care for patients with balance disorders as well. Recently, with the addition of some of the newer equipment that we have and new personnel here at St. Paul's, the addition of Dr. Jane Lee and the expansion of the clinic, it really became obvious that the name was no longer appropriate. Hence, we changed it to the BC Rotary Hearing and Balance Center.
And the center was recently renovated thanks to donors to St. Paul's Hospital Foundation. What impact has the renovation and the new audiology booth had on patient care and staff at the hospital?
We were really struggling to meet the volume of patients that required care for hearing and balance disorders in the province. And the main bottleneck that we had was access to sound booths. Whenever we do hearing testing, we need to do the testing in a very quiet environment, hence the need for a soundproof room. The bottleneck that we had was the limited number of soundproof booths that we had. The recent renovations and expansion that we did included the addition of an additional soundproof room, as well as the addition of 3 programming rooms for patients with cochlear implants. That has allowed us to decrease our wait times from 9 months down to probably less than 6 months, more in the neighborhood of 4 or 5 months at this time, and it continues to drop. So it's been a huge advantage to us.
That's fantastic. Thank you so much.